If you have depression, anxiety, PTSD, traumatic brain injury, ADHD, well, this video is for you. Because you've probably seen a psychiatrist by now. And I have some bad news for you. They've been doing it all wrong. Now, don't get me wrong. The intention is good. I'm sure your doctor wants to help you. Because guess what? I'm a psychiatrist. And every patient that walks in my door, I want to help them. It is part of who I am. But unfortunately, I try to help them with a handicap. Anytime I see a patient, they walk in my door, they have a seat, they tell me their story, they tell me about their symptoms, I listen to them, and then I give them a diagnosis and a prescription. And that works for a lot of patients, but unfortunately, it doesn't work for everybody. Now, imagine if you unfortunately had cancer and you went to see an oncologist and you went to their office, you told them how bad you were feeling, and then they gave you a diagnosis and started chemotherapy. No tests, no blood work, no brain scans. I don't know if you trust that oncologist. See, in the realm of psychiatry, unfortunately, we don't have a blood test, a brain scan, a head image that can tell you exactly what's going wrong in your brain when you feel bad. Well, at least until now. So in this video, I'm going to teach you about a new piece of technology that could be a game changer for you. If you're still struggling with depression, you're still struggling with anxiety, the meds aren't working, they're just giving you side effects, this might be the thing that you need to get over the hump. So stay tuned. I'm going to teach you about personalized TMS and how spectral EEG or a brain scan can change your life. My name is Dr. DuBose. I'm an interventional psychiatrist, and I specialize in helping people with difficult to treat mental health disorders, specifically depression. And I've spent my entire career looking outside the box to figure out how to help you. Traditionally in psychiatry, we kind of throw stuff up against the wall and see what sticks. There's a lot of trial and error. If you're trying to get treatment, oftentimes you try medication. If it doesn't work, you try another one. If that doesn't work, you try another one. And basically your psychiatrist is trying to figure out what's the best medicine for you based on what they see from that experience. That is a horribly inefficient way to get relief from your symptoms. And the reason why it's like that is because, well, we don't really know what's going on in your brain. I can't do a CT scan or MRI to see how the brain's changing. Well, that's why this piece of technology is so groundbreaking, is that I can see your brain in real time and then do something about it. Here's why this is so groundbreaking, is because in real time, I can look at your brain and see exactly how your brain is operating in that moment. By using the spectral EEG, I can map different regions of your brain and see the activity that's happening underneath that lead or electrode and then do something about it. You see, your brain has a very specific frequency it should be creating in different situations. So for example, if you're sleeping, you should be making slow waves. It's like a slow vibration. Okay, we call it a delta wave. And I know if I scan your brain while you're sleeping, then I should see delta waves throughout the brain. However, if you're wide awake and you have delta waves, that's a problem. Okay. Now, I know when the brain is functioning efficiently, it makes a very specific wave called an alpha wave. And that shows up on my scan as a little mountain peak. So I can look at all regions of your brain, at least 19 regions, simultaneously, and tell you which parts of your brain are working efficiently and which parts are not. So the beauty of this is now I have a roadmap of how to help you get healing. So instead of just throwing medications up against the wall to see what sticks, I can look at your brain, see which regions are functioning perfectly, what regions are working too slowly, and what regions are working too quickly, and then tell you a story about how your brain is operating. We use that information plus standardized rating scales, so I can look at depression rating scales, anxiety rating scales, scales to measure for ADHD. And with all that information in one place, I can make the best treatment decision. The way that we change the brain is by using a technology called TMS. TMS stands for Transcranial Magnetic Stimulation. It's an FDA-approved treatment to treat depression. It's also approved for migraines and for OCD, but most offices treat depression. And what this machine does is it can create these rapidly alternating magnetic fields. And when a nerve cell is exposed to these magnetic fields, it forces the nerve cell to fire. Or it can tell the nerve cell not to fire so quickly. So think of it like this. Let's imagine like a marching band, right? Let's imagine like, South Carolina State or something like that. And the band's going, so you got like your drummers and they set the pace of the band, right? And you got your drum majors, they doing their things. And the champagne girls is getting, and I'm not gonna dance like a champagne girl, right? And then you got your horns and you got all your different parts of the band. They're working in harmony. They're going at a similar speed, and the sound that comes from it is beautiful. That's how the brain should operate. But when there's trauma, let's say you get, hit in the head, you get a concussion playing football, or you go to war and you come back, and the trauma is from just everything that you've seen. What nerve cells tend to do is they go into preservation mode, and those nerve cells start slowing down, right? They like try to hibernate. Or other cells go too fast. It's almost like the band's out there playing, and then, explosion happens, and they get all out of whack. Now the drummers are beating at the wrong pace. And you have, the champagne girls walking off the field because they're shocked at what happened. And then you got the saxophones, and they're playing off beat because the drummers are off beat. So now the band is disorganized, and that's analogous to the brain malfunctioning when you have mental health problems. It's out of harmony. It's just not playing together. So what we can do with the scan, the spectral EEG, is I can see how the brain's operating. So I know who's going off the field, who's going too fast, who's going too slow. And then we can use the power of TMS, almost like a tuning fork. It's going to make sure that the brain is firing at the right speed in the right area. So we'll tell those nerve cells that's going into hibernation, hey, you need to go faster. And we'll tell those nerve cells that are going too fast, hey, you need to slow down so we can get the band back in harmony, or the brain working at the correct speed. And what you get is a resolution of symptoms. So the beauty of this technology is this. One, I can scan your brain, see what's going on. Two, I can create a customized prescription specific for your brain. Then I can treat you. Then I retest you to see how your brain changed. And we do that over and over again. So for every 5 treatments, you get a brain scan. And then we make another custom plan. And then you do 5 more treatments. And you do this for 30 to 40 treatments. But the beauty of it is, as the brain gets in harmony, your symptoms decrease. So what would this look like in real life? This is not experimental technology. This is something that's available now. Now, it's not available everywhere, but you may be able to find a center that's close to you. I want to share a vignette of a patient I recently took care of and kind of walk you through what the experience is and what the results were. So if we were to do this treatment, basically it would start with a brain scan. And that brain scan, you would receive a report, and it would include the spectral EEG, which is the map of your brain, and your rating scales of your symptom severity. The doctor would take this and create a customized treatment plan, and you start the TMS treatment, which entails light tapping on different parts of your brain with that magnetic energy. And that's what encourages your brain to fire at the right speeds. You'll do this every day, 5 days a week for 6 weeks. And on the 5th day, you do another brain scan to see how the brain is changing. And the cool thing about it is, this is not something that takes forever to work. Many patients will notice results within about 5 to 6 days. Most commonly, a reduction in their anxiety and improvement in their sleep. By the end of treatment, the hope is, a resolution of the main complaint. So this is the exact thing that happened to one of my employees that I treated that struggled with very severe depression to the point that she couldn't work anymore. And she had tried everything. She had done at least 10 different medications. Our practice is a ketamine clinic. We also did ketamine treatments with her, and nothing was moving the needle. Her depression and anxiety had gotten so bad she couldn't leave her house. So by working with her, with adjusting her medicines, but also starting the personalized TMS, she went from homebound to depression free in about 6 weeks. It's amazing to see how rapidly the symptoms can improve without the risk of the side effects of the medications. I wanted to make this video just to let you know that there are other options out there other than just medications. And the most wonderful thing that we've added to psychiatrists is the ability to actually diagnose what's going on in your brain with objective data, with something concrete that I can look at to tell me what's going wrong in the brain, so I can finally do something very specific and tailored for your particular brain to help you feel better. If you struggle with your mental health and the medicines are just not enough to get you where you're trying to go, I put a link below to a website to learn all about this technology. And there's a provider locator there, so you can find a provider that's closest to you. Thank you for your attention. Please leave a comment below if you have any questions. I'll try to go through all those and answer your questions. But stay tuned. I'll do a deeper dive on the spectral EEG and personalized TMS. Thank you for your attention. See you next time.